In 2009, the first family-owned and operated American Vein and Vascular clinic opened in Pueblo, and now they're Colorado's largest network of vein clinics. Their vein specialists perform the latest therapies to remedy vein disease, and today founder Dr. Gordon Gibbs is here with us. Dr. Gibbs, thanks for being here. Let's talk about some of the great services that you provide.
Yeah, so American Vein and Vascular Institute, as you mentioned, is the largest network of vein practices in the state of Colorado. We're a medical practice, we're independent of hospitals. And so some of the things that we can do are treat people with mostly leg pain related to their circulation. So one of the more common things that we can run into are problems with their veins. And one of the most common scenarios is people come in with achiness, heaviness, discomfort, pain in their legs, cramping in their legs, restlessness. Sometimes it's at night. And so we can fix that. We can identify exactly where it's coming from and come up with a treatment plan that's going to work to take care of it.
Those are some of the symptoms then, huh? The achiness or the heaviness that you might be feeling?
Absolutely, yeah. So most of our patients, probably 2/3 of our patients are women, 1/3 are men, generally adults. So vein problems typically don't occur as teenagers, but they do progress over time and get worse. And so most of our patients are adults, and most of what we do is run through insurance, and so it's very, very treatable from that perspective.
Now, what are some of the causes of vein disease?
Yeah, it's generally genetic, and so that's kind of where it starts. So you can kind of blame it on mom and dad, or
Thanks,
I suppose
guys.
in some settings you can blame it on your children too, because many women who have had multiple pregnancies will come in and they have vein problems.
The weight of those pregnancies can
Yeah,
tend to
that's
do
right.
that.
Yes, indeed.
May know a little bit of experience there. Let's talk about Socktoberfest when it comes to compression socks. This is something we've talked about in the past together before.
Right.
Talk about that and why it's important to you guys.
Yeah, so this is a great time of year for us. The Socktoberfest is really kind of a campaign that we do where we offer, two for the price of one. And compression stockings are something that many of our vein patients use to control the symptoms in their legs. So their legs are achy, they're uncomfortable, they're tired towards the end of the day, and compression stockings can really help with the way they feel, can give them a little bit more spring in their step. And so it's sort of a campaign of awareness, but it also really does help people.
That is nice, but you also recommend really having medical grade compression socks, right? Versus, let's say, buying at a big box store or something.
Yeah, these socks are tight. They're really tight, and they're meant to do a job. I mean, they're different than regular socks. They're meant to squeeze your legs with a high degree of compression. And so if they don't fit properly, they can cause some problems, and they're uncomfortable. And we have many people come in and they say, well, I hate those darn things because they're too tight. They just don't work. And it's because they're improperly fitted. So if you get them fitted appropriately, you get very precise measurements on the legs, then they generally work very well.
So let's talk more specifically on how it really helps those symptoms then, those socks do.
Yeah, so one of the things that we treat is venous insufficiency, which is basically a phenomenon that occurs where there are small valves which open and close in the veins and keep the blood flowing in one direction from the feet back to the heart. And so it's very common those valves can become leaky, and that allows gravity to pull the blood down towards the feet. It puts the veins under pressure, and as that pressure builds, the veins can become enlarged with time, so that's where varicose veins come in. But the pressure hurts, it's uncomfortable. Your veins just feel congested, and so by squishing those veins down flat and pushing the blood out of your legs, generally it controls that pressure and your legs feel better.
Now, you mentioned insurance earlier. Talk about the types of insurance that you accept. This is something that normally is covered, correct?
Yes. A vast majority of people who walk through our door are covered by their health insurance. So we take Medicare, we take Medicaid, all the commercial insurances. We're somewhat limited in the Denver Metro with Kaiser, but certainly not for compression socks. So compression is something that we endorse heavily in our practice, and so most patients who come in will have compression socks in some way, but you don't need an appointment. You can come in and get measured for the socks. You can have a custom fitting for them. It's all free. There's no appointment necessary. So they can just come in and look around. We have a great selection of athletic compression, medical grade compression, a variety of colors and styles to suit everybody's desires. Because where you have a choice, you're generally happier.
Yeah, absolutely. One of the great things too is that you have so many different locations, and this is wonderful for a lot of people. You really have grown over the years. When you
Yes.
say largest, you definitely are. Talk about where you guys are located.
Yeah, so we have 9 locations around the Front Range, down from Canyon City, Pueblo. We have 2 in Colorado Springs. We have 2 in the Denver Metro, soon to be 3. Thornton, Vail Valley, up in Fort Collins as well.
That's pretty nice. So no matter where you are right now when you hear this, there's probably a location near you, which is wonderful. And again,
Yes.
you don't need that appointment if you want to go in for those socks, correct?
That's correct, yeah. And honestly, they make great gifts as well. And so if you don't need necessarily 3 pairs for yourself, Christmas is right around the corner, the holidays, they make great gifts. Everybody knows somebody with vein or vascular problems, and they're very helpful. So you can gift those to a family member. Great stocking stuffers. Stockings in the stockings.
Absolutely, stockings in the stockings. That's actually really nice. This is one of the things too that you always say, hey, listen, deductibles are going to be resetting pretty soon. So making an appointment, if you choose to do that before you come in to see you or a doctor, it probably should be done sooner than later.
We see a lot of new patients this time of year. It's hot outside. People are looking at their legs. They recognize that they might have a problem. And what we try and do is we're trying to be an advocate for their care. And so if somebody recognizes that their deductible is resetting at the end of the year, now is a perfect time to make the call and get seen.
Yeah.
Because a lot of times we can identify and come up with a simple solution, but if it does require treatments, it's nice to not wait until the latter part of December, because many times we're frustrated, the patients are frustrated that we just can't get them in before the end of the year.
Absolutely. Dr. Gibbs, thank you so much.
Thank you.
Love your legs again, guys. American Vein and Vascular Institute offers minimally invasive in-office treatments options for venous disease. And for the month of October, it's Socktoberfest. Buy 2 pairs of compression socks and get 1 free. Stop in at any of their 9 locations for a free custom compression wear fitting. You can call their number today at 8445-MY-LEGS. That's 844-569-5347. Or visit them at AmericanVein.com for more information. They paid for today's segment. Stay with us.